Hi, it's Joe Ruffalo, the President and Chief Executive Officer of Niagara Falls Memorial Medical Center again to give you another continuous update of the very fluid situation with respect to what healthcare systems, healthcare workers, physician providers are facing with respect to the coronavirus. So today I'm here with our Chief of Emergency Medicine, Dr. Gerald Gorman. Dr. Gorman is very well known throughout the region with his clinical expertise in emergency medicine. He actually went to medical school at Georgetown, did his residency in emergency medicine at the University of Buffalo in 2002. He finished and has been practicing now for almost 19 years. So clearly a clinical expert within his medical field, a true leader for the region. He's been our chief since 2007, and we're here to give you an update with respect to coronavirus issues as it relates to the emergency room. So earlier I had shared with you that the Office of the Governor wants all hospitals to increase their bed capacity by over 50%. We have been ahead of the curve. We've been doing this planning efforts now for almost a couple of months, and we've actually identified areas where we can now increase our bed capacity by another 56 beds, which includes about a dozen more critical care beds if or when need be. So we are well prepared. But I thought it would be helpful for Dr. Gorman to share with our viewers in terms of the preparation that the emergency room team has been doing in the event of a surge, and then also answer basic clinical questions as it relates to the coronavirus. So, Dr. Gorman, could you share with the viewers our surge plans if in fact there's all of a sudden an increase in emergency room activity?
Absolutely. Thanks for that introduction, Joe. I want everybody to know too that although it's kind of a very chaotic time in life and certainly unprecedented, that we are all going to come through this. There does need to be some calm amongst everything that's going on. We in the emergency department, I speak for myself and my colleagues, feel very well prepared for everything. This is not something that we haven't at least done drills and prepared at least somewhat for. There's always some type of catastrophic drill or something that the emergency department and all hospitals really have to go through. Corona certainly is testing all of our resolve, but we will, as a community, as a hospital, all of us are going to come through it. In terms of surge planning, we've been doing this for a while, like you said. This is not something that has just been started, within the past week. So you just kind of have to identify everything that you're doing in terms of patients coming in by ambulance, patients walking in, your education to community, doing things such as this. But what we're doing is just really identifying the processes, people who are stable, people who are sicker, where they go. They're going to be going to different areas. We also have staffing models. All of our staff, that's not the emergency department staff, but the staff within the hospital, family medical doctors, surgeons, ready to step in the event that we need more staff or whatever that may be. That's doctors, that's nurses, that's PCAs, that's housekeeping. So we've really kind of identified in the event that all of a sudden we see these surges of patients. We're actually trialing a lot of what we're doing now. Volumes at our place as well as amongst other hospitals are down. So now you want to be doing these processes now, kind of working out some kinks, and that's what we're doing. So we're kind of involving everyone in the surge planning. Everybody is kind of going through it right now. And I really think that in the event that it happens, we're going to be much better prepared because we're starting now when it's not at that capacity.
So Dr. Gorman, when, as we all know, in Western New York, there is an extreme shortage of testing kits still. The reagents don't exist in terms of what has been utilized, and hopefully next week, Erie County and the commercial labs will be getting more reagents so that more testing can occur. So when patients present symptoms when they come into the emergency room, and again, we have encouraged residents that if you're symptomatic, do not automatically come to the emergency room, call your primary care doctors, the Erie County hotline. But if in fact, you have a lot of comorbid situations or issues with you, and you can't breathe, and it's really an emergent situation, and you have to come to the emergency room, what are some of the things that you do to kind of determine whether it's a possible coronavirus or it's the flu? What's the protocol?
That's a great question, because, and I understand everyone's apprehension because everybody wants to know, do I have it or not? It's everybody's main concern. So you do have to triage those who have a higher probability of having it or not, or do they have something else like influenza? So just give you an example here. You got a patient who has a fever, cough, the typical things we associate with COVID, but it could be influenza. Influenza is still very prevalent in our community. We've had multiple positive influenza tests this week. So we would take that patient, give them masks similar to this, put them in one of our isolation rooms, and then we would start a medical workup, chest x-ray, blood work, rapid influenza swab, something called a respiratory screen. In the event that, depending on what their tests show, maybe their influenza test is positive. We've had some of these this week. You treat them for influenza.
And they could go home?
And then they could go home provided that their oxygen levels are okay, they're breathing okay, and so forth. And if they qualified for a medication called Tamiflu, they may be put on that. But then your usual, rest, fluids, Tylenol type of thing. They had maybe a pneumonia, but in a negative influenza, depending on how sick they are, you may end up admitting them to the hospital. Those are the ones that, at least locally, are more likely to get tested. And that's kind of how the process is right now, because you do have to triage, and it's really more the ones we're testing are the ones that are probably sicker.
And so we'll have the capability to sort of pre-triage.
Correct.
When patients come in.
And the rationale for that is exactly that. A lot of this disease is very mild or even asymptomatic. So you do have to tell those people, you got to go home, try to, stay self-quarantine for 14 days. There may be testing coming online within a couple of weeks, but those are the ones that we're just not testing right now. You just have a limited resource, so you really have to target it to those people that you may change your treatment.
And the good news is the one patient that we had, the inpatient that was tested positive, was safely discharged yesterday to home and is under quarantine, thanks to the great care of our experts and Dr. Gorman and his staff and Dr. Bajwa and the nursing staff.
Yeah, that case went well, and I'm sure there'll be more, and you're going to be hearing about more as more testing is done. Inevitably, there's going to be more positives. It's not necessarily something for everybody to worry and be so concerned about. That's just naturally how you do it. That happens with influenza every year. Once you start testing for it, you get a lot more positives.
So in conclusion, we're very blessed to have Dr. Gorman and his team of providers, along with our emergency room staff, for their dedication, their passion, and their commitment with respect to caring for all the residents within the Niagara region. Thanks, Dr.
Oh, thank you.